This is an interview with Marc LaForce on July 11th, 2008 at the Centers for Disease Control and Prevention in Atlanta, Georgia. And it's about his role in the Smallpox Eradication Project. The interviewer is Chris Zonizer. With this interview, we're hoping to capture for future generations the memories of participants and their families involved in eradicating smallpox. This is an incredibly important and historic achievement, and we want to hear about your experience. I have some questions to guide you, but please feel free to recount any special stories or anecdotes that you remember about events or people. The legal agreement you signed says that you are donating the oral history to the U.S. federal government, and it will be in the public domain. For the record, could you please state your full name and that you know you are being recorded?
My full name is François Marc LaForce. I do know I'm being recorded, and I do and agree to this.
Thank you very much. Thank you for coming and sharing your stories about the Smallpox Eradication Program with us today. I guess I'd like to start by asking you to talk a little bit about growing up and how you became interested in the health field, where you went to college, what you thought you might want to be when you grew up, and how you kind of got into all of this.
Sure. I was born and brought up in the state of New Hampshire. My father died when I was quite young. I was about 13 years old when my father died. And we were a large family, 6 children with a mother and not much money. So everybody went to work. One of the positions that I started working at was in a drugstore, a local drugstore, and that was my first initiation into the health field. Drugstore called Precourts Pharmacy in Manchester, New Hampshire, and worked there from the time I was probably 15 and a half, off and on for maybe the next 10 years, while I went to medical school, college, etc. And I think it was that experience that brought me into contact with people who were ill, people who needed help, counsel in terms of medical issues. And I became progressively more interested in the field. I went to college at St. Anselm College, which is a Benedictine liberal arts school in Manchester. And decided to major in chemistry. I became very interested in the sciences. And as I finished college, I started putting things together in terms of individual career plans. And I thought that perhaps medicine might be a way of meeting some of the needs that I had. Needs in terms of the science. These were all areas that I enjoyed, and I did quite well in school. And at the same time, I felt that I really wanted to have a human element to my career. When I say a human element, I've always enjoyed the challenge of helping people. And I make no bones about that. This is one of the driving forces that makes me me. And so putting all of that together, in my last year, decided instead of going on to postgraduate work in chemistry, to apply to medical school. And I was accepted, went to medical school. Started in 1960, finished in 1964, and after did my postgraduate training at a large city hospital in Boston. That is the Boston City Hospital, which at that time was a 1,000-bed public hospital for the poor and the disadvantaged of Boston. I was fortunate to be on a wonderful teaching service called the Harvard Teaching Service, the 2nd and 4th Medical Service, and spent 2 very happy years as an intern and first-year resident. But this was Vietnam. This was the era of Vietnam, and every physician was in the military, functionally. And initially, I had been drafted into the Air Force, and Dr. Charles Davidson, who was one of the leaders on the medical service at the Boston City Hospital, asked if I could postpone going into the service. In other words, he didn't ask me, but he basically said, would this be acceptable if I postponed going into the service? If he asked whether the Centers for Disease Control would have a position for somebody like myself. And so through a very curious chain of events, I ended up coming to the Centers for Disease Control here in Atlanta in 1966, never having traveled further south than New York, because I was in medical school in Jersey City. And I didn't know much of anything, but I do know that one of the questions somebody asked is, do you like to travel? Well, never having traveled, I answered the question, yeah, I'd love to travel. And so they said, well, this is probably for you. And so ended up here. And I spent 2 years as an epidemic intelligence service officer, and quite soon found myself in a variety of environments that I found terribly interesting, including a month-long assignment south of the Mekong River doing malaria work for the then Malaria Eradication Program. I really enjoyed the new culture, all the challenges that were associated with that, with the Thai culture. Later in, I guess it was 1967, there was a plague epidemic in Nepal, about 40 miles south of the Chinese border. And I soon found myself being helicoptered across the Himalayas into an area, a desolate area in the middle of the mountains where people were dying of this unknown malady. And I was very fortunate on that trip. Phil Brockman, who was the head of the epidemiology group, was really my mentor, and I owe Philip an enormous amount. That trip was also very formative because it taught me that I could pretty much work in almost any environment. Really, that didn't bother me one way or the other. I mean, floors were as good as a bed. That was never an issue. And so I finished my EIS training, went back to Harvard, finished my clinical training and infectious disease training, but kept a very strong working relationship with the Centers for Disease Control, particularly Phil Brockman and the EIS program. And Phil approached me, it would have been probably in either the summer of 1974, and said that there were some issues with the Smallpox Eradication Program. There were problems as far as the India program, new outbreaks, and would I consider lending a hand as a smallpox officer. And it meant going overseas for 3 or 4 months at a time. I thought it over, talked it over with my wife, and decided to accept that challenge and left for India. It would have been probably either the 30th or 31st of December of 1974, such that I was in India either the 1st or the 2nd of January 1975. And at that time, smallpox had broken out in a major way in Bangladesh. And so working in Delhi, I met Stan Foster. And Stan was the head of the Smallpox Eradication Program in Bangladesh. And he said, Mark, why don't you come over and work with us? And so he talked with the people in Delhi. And before I knew it, Nick Ward, Stan Foster, and myself were on a plane. And I'll bet it wasn't 24 hours after I got there, I was on a plane going to Dhaka. So I landed in Dhaka and spent probably 2 days being quote-unquote briefed. Now, I would point out to you, I didn't know anything about smallpox at that time. I knew a fair amount about a lot of other diseases, but I remember Nick Ward saying, well, you don't know anything about smallpox? He said, you come with me. And so he brought me to the sort of local hospital. We went through the clinical manifestations of it, all at the same time he's telling me about the epidemiology, what the challenges of being a field worker were, et cetera, et cetera, et cetera, et cetera. There was an opening in the northern part of Bangladesh, a place called Kurigram Subdivision, which is close to the end of nowhere. And Stan then basically said, look, there's a gap, there's a major epidemic that's going on in this area. The officer has just left. We'd like to send you up there. And so that's how I ended up in the Kurigram subdivision. And to get up there required a plane flight to a small local airport, and then somebody getting on a Land Rover, and then getting to this river, and then getting the Land Rover being put on 2 boats that are lashed together, and then the boats going across this fairly wide river where you're on it. And so we get to the other side, and that's the subdivision. There are no roads. And so it's essentially a Land Rover and these muddy, only it weren't muddy, this was the dry season, but what the remnants were of the bullock cart roads.
Did you have a team that you went with?
Yeah, when I first went over, there was no team. I was just sort of brought there and introduced to Dr. Roof, who was the Bangladeshi medical officer who was there. And that was pretty much it. I was very lucky in that there were some missionaries that were there, and they offered to house me. It was part of a compound, and they were not missionaries. Maybe they weren't exactly missionaries, but they were part of a group called a Rangpur Dinajpur Rehabilitation Project. But they had a series of huts that were on a compound, and one of the huts didn't have anybody, and they offered to sort of let me use the hut. So I was very lucky. I ended up with a hut. Then it was necessary to figure out how much petrol there was, because there's nothing. Everything you brought over yourself. And I soon found out that there wasn't very much petrol, that I needed to obviously get an interpreter, and there was a driver that was there, and that was pretty much it.
Did you have a Bangladeshi medical counterpart in that area?
Yes, the medical counterpart was Dr. Roof. But he also had many, many other administrative functions, and I soon found myself on my own with the interpreter and my driver. And we essentially became a team for the next 3 months.
How did you go about identifying an interpreter?
I asked around, and it was a young man whose father had been an administrative type that had worked under the British Raj when the British were there. So he had managed to make sure that his son knew some English. And so I was introduced to the son, and the son was, I don't think he was much more than maybe 17 years old. But he certainly knew Bangladesh. And he and I had no difficulties at all exchanging information in English. And so what I then did is trained him to sort of work with me. in terms of the smallpox or the needs of a smallpox medical officer.
How'd you go about identifying the cases that were?
Cases are easy to identify. Smallpox is such a bad disease.
How about getting the reports to you? Was that hard?
Yeah, that was very hard. Under the normal circumstances, there's a surveillance team that was based in Kurigram, and the surveillance team had these small motorbikes. And of course, I was the provider of the petrol for the motorbikes, so I was the supply sergeant, as well as the gas station attendant to make sure that none of it disappeared for other things. You can imagine, it all just becomes part of a daily routine. Well, as you know, part of the most important issue in managing smallpox outbreaks is, number one, recognizing the cases. Once you recognize the cases, then you can put into play what's called ring vaccination, or you can establish a perimeter around these cases so that that perimeter is all immunized. And so there are no cases or no disease can spill over outside of this perimeter. In order for this to work, you got to get there quick. You got to identify every single contact that that individual had when the individual was potentially infected. And lastly, you really have to organize yourself to make sure that everybody is immunized. So it meant that when you came into a particular village, you had to get a lot of information fairly quickly. And part of the magic of creating this team is we got very good at who would do what. In terms of there was a map that had to be drawn to figure out exactly where we were, which huts, et cetera, et cetera. Secondly, the contacts had to be done, and if there were contacts that had left the area, you then had to notify the district where the individual had gone by the only means of communication that we had was this radio that you could hook onto the car battery. And that's what you had to take the car battery out every day just to sort of make sure that we could communicate across not only to Dhaka, and then Andy Agel, who was there, would then serve as the connector with all the other areas in Bangladesh. So once you did all of that, if you did your work properly, you were able to carefully identify all the cases, and quite soon the individuals that you had vaccinated, you could see evidence that they had been vaccinated. And so you usually stayed in the area long enough to make absolutely sure that you were satisfied that this was okay. You then hired 1 or 2 house guards, because there had to be house guards in order to make sure that no one would come to see that particular individual unless they had gotten immunized. So you left vaccine with that individual, and you paid them a little bit of money to actually serve as house guards. So you had to usually recruit, young kids or somebody, but you ended up having to recruit within the village, as well as speaking to the village elders and explaining exactly what this is all about. And if you didn't do that, then you didn't get very good cooperation. And after a while, you developed almost a sixth sense. Was I really schmoozing or communicating with this individual? And if I was, chances are everything was going to go well. So once that was set up, then it was a question of responding to all the rumors. Because there might be a runner who would come from village X, Y, and Z and say, there's a new rash illness in a young boy or an old man or something like that. You need to come see. And so that was sort of the information package that we had.
How did you divide up the roles of, it sounds like there were a lot of tasks going on, and it was basically you, your interpreter, and your driver. What exactly did you do, and then what other responsibilities did the other 2 individuals have?
I did pretty much everything. Yeah, and then as I said, we matured as a team. Zoha, who was the name of the interpreter, the young boy, then became very good as we went into a village, of making sure that I saw the right village elder, that he brought all the people around, and then he would do all the explanations. And I understood a little. You get, after a while, that you could understand some Bengali, but clearly he knew exactly how it was done, and we sort of rehearsed it, that these are the important points that we need to, and he was a very, very clever young man. And the driver, the driver really made sure that the transport stuff was okay, and the driver always had tea with all the other individuals, and he was essentially the spy, or I won't say spy, but he was the sort of the intelligence officer for us. I mean, he just schmoozed with everybody. He spent time in the village, etc. And then he'd come back and he'd say, no, this is fine. There's no problem. Or this man's having a little trouble with this. You may want to go see him individually. Mm-hmm. And so, and over a period of time, and it probably took 3 or 4 weeks for all of this to gel. When I first got there were a lot of cases. I mean, a lot of cases all over the place. And we worked from morning till night just trying to keep up with the cases and with the stuff that had gone on. And I didn't feel that we really mastered that situation until probably well into the second month. But by the second month, all the old cases were then, either had recovered or died, and that was now finished. And we were now managing the sort of new stuff. And I was very proud of what we were able to sort of get done.
Were you going back to your hut each night, or were you needing to
Sometimes
stay
I
overnight?
did. Sometimes you slept pretty much wherever you ended up. If I was anywhere near, I would try to come back to the missionary's hut in Kurigram, because I did want to try to make sure that I had a shower, because it was so dusty and so dirty that essentially I showered with my clothes on. I just walk in, and usually I'd have to pump the water up, because there was never any water that was up above, and that took a while to make sure there was enough water. And I was a lucky one, because they had set up sort of a shower. And so then at least then what I did is I just showered with my clothes, and then took my clothes and then washed them as I showered. And then, sort of hung things out in the room for them to dry, and then had an old kerosene burner, and then I usually kept the rice, and then made my own, just cooked, whatever was around, vegetables, whatever, and rice.
When you were going into the villages and you found a case, and then you were immunizing the family members and
Correct.
the people in the neighborhood, in the neighboring houses, were people receptive to you and taking the vaccine, or did you ever have any problems or any challenges in that situation?
Not often. I think most of the people were really well aware of smallpox. Guti bushunto is what they called it, and no one liked this disease because it marked you. It's like George Washington. That's why his face was the way it was, and people didn't like smallpox. So we didn't have. Occasionally, you had some young guy who really was unhappy with this, that, or the other thing, who gave you a little bit of a hard time, but that wasn't very often. I think most part. And the Bangladeshis are wonderful people. Oh my God, they really out of their way to sort of help you. I really have incredibly warm feelings for them. But you asked in terms of the accommodations, if we were a ways out, like way in the north in Lalmanahat or something like that, the chances are you just sort of, if there's an administrative place, like a health officer place, usually you could put 2 tables together, and then you just had an inflatable, you just inflated a mattress, and you put a mattress on top of the table, and that's where you slept. And that wasn't that unusual. I slept in a car a couple of times. It was a Land Rover. I remember the Land Rover a couple of times. Not preferentially, but it was just you didn't have anything else to do.
How much of the time did you need to walk back into the villages as compared to driving?
Actually, some of the times, because some of the outbreaks, that's an interesting question, are in a place called the Chars. The Chars are the riverbed of the Brahmaputra River. They had just finished a famine also on top of all of this. That was one night. I never forget that as long as I live, when I saw the rats run. There was no food in that area. Just no food. The famine had come in 1975, or the floods had come, and they had a bad yield the year before, and then this swept it away. So there was really very little food. And I remember one night just literally seeing this carpet of rats just leaving the area. It was the most amazing thing I've ever seen. And, well, coming back to the story about the Chars and walking, the Chars are this very, very fine sand, extremely fine, finer than beach sand. And so once you got even a Land Rover stuck in there, you could usually work it out with the winch and stuff like that to get it moved out. But it was such a pain in the neck that basically I said, we might as well walk in. So most of if you had epidemic areas that were like on these islands or something like that was in the Char areas, most of those you walked to. It wasn't that bad. Wasn't that bad at all. Because the time of the year was during the dry season, and it wasn't. I didn't find it uncomfortable at all.
Were you there during the wet season also?
No. I left just before the wet season began. I always remember that. That was the last night I was there. They had a huge rainstorm.
So were you in Bangladesh then 3 months, or
Yeah,
was
yeah.
it longer than?
Yeah. It was a little over 3 months, and then went back to the U.S., and I had a lot of trouble readjusting to the United States after that. First off, I never used a knife and a fork when I was over there. You just get used to using your hands for everything. And I came back, and I must admit, my wife thought I was crazy. I really was a little nutty.
Did you have any problems with the food or the water?
No.
Or just finding
No,
safe things
yeah,
to eat and drink?
I could always buy enough rice. As long as I had rice and tomatoes, you could make it. I lost 15 or 20 pounds during that particular exercise. But, I spent a lot of the time alone, but there was the other smallpox team across the river that I would go across that river where we had our own regional meetings and stuff like that. And then when we all met there, we all ate at restaurants, a local restaurant, and had food there. It wasn't bad.
You had mentioned earlier about needing to be careful that people didn't steal the petrol. And I'm wondering how you monitored that, and then did you have episodes where you needed to be, very concerned about other things, disappearing supplies, or cautious about security or the police or anything in the areas that you were?
Yes and no. Most of the answer is that I really wasn't that concerned. First off, I'm a pretty big guy, and I was older than the rest of the people. I was over there when I was 35 years old, so I wasn't a 24 or 25-year-old kid. I was already pretty grown up, and so no one actually ever hassled me. And how did you keep track of it? It's the old British way. I had a long stick, and you marked it, and you put it into these barrels, because that was how you did. You basically, I lugged over those 55-gallon drums is how that stuff came over. And so every trip that I made after that, we had at least two barrels. And then I had it in a locked area. And I had the only key, and so they provisioned themselves on that basis. And then after a while, you get to know people. The people were very honest. I didn't have any difficulties.
Changing the subject a little
Sure.
bit, Dr. Foster mentioned that you kept a diary.
Yeah,
while you
when
were
I
there.
went over there, I decided that this was so different. The country was so there. Everything was so different to me. This was so different from Thailand, so different actually quite different from Nepal, because Nepal, that was in the high country. And so what I did, I meticulously kept a diary every single day. I wrote out, after I came in, showered, had a little something to eat. I had a kerosene lantern. You know, this is like Abe Lincoln. You know, I lit the lantern and sat down and wrote my diary, as well as a letter to my wife and kids. And then once a week, I'd try to get the letters posted. But I kept a diary. And then when I went back to the United States, I had my secretary transcribe it, and then I put pictures in that particular diary. And then I had it bound by a German bookbinder because I wanted this to be in my library, my personal library. This was a piece. I didn't share it with anybody. I didn't share it with anybody. The only person who knew that I had a diary was Stan Foster. And subsequently, I've copied the diary, and I sent a copy of that diary to Dave Sencer.
Oh, wonderful.
So
that'll become part of this
yeah, it is.
living
it
history.
Is part, and everything that I've told you is in that diary.
Nice. Thank you. Thank you. Are there other memorable events that occurred? That
a couple
when
of
you
times.
Were, you know, or things that especially just stand out in your memory that...
Yeah, I was getting ready to leave. It was my last trip to Dhaka before I went back up country. And in those days, the smallpox medical officer was what I call the bagman. The bagman meant you had all the money. And so all these people that you had to pay, you know, if you had to pay so many people for the workers who were doing the immunizations and all of that stuff. And so you had to do all of that. And you had to maintain impressed accounts, and certain amount of money was given over to you. And so I always carried it in my satchel. And I remember my last trip into Dhaka, before I went up country, they had identified somebody to replace me, a young man coming from Norway. And, oh, God, everything was fine. The cases were, we had no new cases. I think I was down to one case for this whole area of 3 million people. And I really was on cloud nine. And so I flew up there, and I remember going to a hotel, and it's sitting, there's one Intercon hotel in Dhaka at that time. And I remember saying, I'm going to splurge. I'm going to buy a beer at this Intercon hotel. And so then I went back up country. And then I was only going to be up there for 2 days to make this transfer, give this guy my kerosene burner, show him all that stuff, and then get him introduced to the missionary so he had a place to stay and everything was going to be all right. And then my driver runs up to me and he said, your money no good. And I said, what? The government of Bangladesh had decided, because of all the currency problems that they had had, to discontinue honoring 100 taka notes. I had a satchel full of 100 taka notes to pay my people. So here I was with money that was no good, up country. So I said, well, I got to fly back with the satchel. So I made my way back and was able to put some money together with small notes that people had. So I put all of that stuff together. And then got on the plane, and then got off the plane. And only this time, when I got off the plane, the police were there. And the police were specifically there to catch the money smugglers. In other words, those people who were trying to bring money back in before the deadline. The deadline, I think I had 2 days to turn the money in, or else the money was worthless. And so I showed up, and then all of a sudden got brought into a back room with these, and I have a satchel that I don't know how much money I had, maybe 30,000, 40,000 takas in notes. And then with a couple of guys with machine guns, and then a guy with he was like this, and I said, what on earth is going on? And then this was a little nerve-wracking, and then until finally, I said, I'm WHO, and they said, wow, we don't know anything about this stuff, you're a smuggler, you don't have your other papers, Now, I didn't have any other papers. I never used papers when I was in Bangladesh. Everybody knew who I was. To make a long story short, I was allowed one phone call. And I made the phone call, and I've forgotten the name of the guy that I got, but I got one guy at the smallpox office who actually came down and straightened it all out. I'm not exactly sure what he did.
Whoa.
But all I know is that I got out, and I didn't get out with the money.
Mm.
The money stayed.
The money stayed there.
The money stayed there, but he got all the receipts. He got everything that was needed, and I was okay.
Mm-hmm.
But I thought that was a very, very strange event, and it took the better part of a day. And I thought it was a wonderful lesson to me. In terms of saying, everything is fine. You know, I've done all this great job, everything is fine. And then the next thing you know, I got this police officer with these couple of machine guns that look pretty serious guys, you know, and there's a lot of money in the bag.
Right.
You know, it's like one of these movies.
Yeah. You're lucky to walk out of there, I think.
Yeah. No, I would say there's that. Plus the other part of it was being able to experience in a profound way a culture, a people who were desperately poor, but proud, industrious, intelligent. They taught me an enormous amount. You know, it taught me a lot about myself. Mm-hmm. You know, we have these strange fantasies about ourselves. We're wonderful, we're great, we're not. And as I told Stan Foster before I left, the experience there taught me that I'm not as nice as I thought I was. And I think that sort of insight has been incredibly useful to me.
Were there times that you had to, when you say not as nice as what I thought, that you had to be more directive or...
Yeah, I jailed people.
For?
No, I had a...
Not getting vaccine?
No, I had a bunch of people who had smallpox, and I had no way of controlling them because there were a bunch of kids. So what I did is I found a jail in this town that had a jail in it, and I jailed them all.
Wow.
You know.
Mm-hmm. Kept them quarantined, then, right?
Yeah, it was a way of quarantining it.
Right.
But
yeah.
I'm not sure I'd want to talk to a human rights
Right.
person about that kind of stuff. And, yeah, you know, there are issues that, and that's why these are obviously insightful things. I almost felt like towards the end, that this was a military campaign, is how this was approached. And that these were essentially military rules, that expediency, getting the job done, getting this done, getting that done, and then work it out. I tried to be kind, but sometimes I wasn't.
Right. Sometimes you couldn't be. So I feel like I could keep you for another several hours with questions.
No, I think there is one other thing that I think is worth reflecting on. That experience was so profound for me that I've never left international health after that experience. I then took a sabbatical and joined Rafe Henderson and as one of the charter members of the expanded program on immunization. Stan Foster and I worked together through the 80s for the Combating Childhood Communicable Diseases program in Africa. Mm-hmm. And then I continued international activities that now have finished over the last 10 years developing a meningitis vaccine for sub-Saharan Africa. So, and I think back and I think I'm not sure that ever would have happened to me had I have not had the sort of experience that I had in Bangladesh. We're so fortunate, as Americans particularly. I mean, we are so fortunate with the freedoms that we have, with the wealth that we have, that I just felt that there had to be some way to either repay or acknowledge all of the comforts that have been afforded to me and my family. And my family.
So it sounds like you just had just a fabulous experience.
Absolutely.
And you answered my last closing question was going to be, how has this affected your continued career in public health? And I think you just did a very nice summary.
Very dramatically.
Absolutely, absolutely. It's just kind of one of those unique experiences, even though it sounds like you were a little bit older than many of the people that were out on the smallpox eradication campaign, and but yet it still directed you very clearly, to do other international global health activities.
That is correct.
So, anything else, Mark, before we?
No. As I say, it's. I consider that time, as I've said before, an extremely formative time for me, and something that I will always treasure.
Well, thank you very much.
Oh,
Thank
you're
you
welcome.
for spending the time and sharing with us memories about your experience in Bangladesh.
Okay.
Again, it just sounds like just such an incredible experience, and certainly part of the legacy of CDC. And so I know you are so proud to have been involved in eradication efforts.
Absolutely.
Thank you.
You're welcome.